Start again. Okay. Okay. This is Laurie and Pear discussing Module 10, personality disorders. We're discussing the vignette of Jordan. Would you like to start?
Um, sure. Let's see. Question one is uh, what personality disorder diagnoses might be excuse me, might be considered based on Jordan's presentation? And hold on one second. I've lost you there. I'm trying to call up both the questions and the Zoom screen. Okay, sorry about that. Um,
Okay.
okay, what personality diagnoses might be considered, and then what specific criteria supported? Are there multiple possible diagnoses, and where do you see overlap? So, I don't know about you, Lori, but when I first looked at this, I was like, oh yeah, no, it's just one. I
Yeah,
mean, like I was looking at the thing, and I was like, this is because Jordan seems to meet all of the criteria pretty quickly, the borderline personality disorder
that was
criteria.
exactly for borderline personality
Yeah,
disorder was my initial kind of gut reaction to that. But
yeah,
even more,
yeah.
I'll let you go ahead first. What your second thought or
Oh
the
yeah,
other
I was
thought?
gonna say, so at first I really thought that, and maybe you had the same experience. Then
Mhm.
as I drilled down, I was like, well, okay, no, there's some that definitely do not seem to be the focus of Jordan's presentation, and that you could imagine pretty quickly ruling out. They don't seem to be meet the general criteria in the presentation. But then there's others where we'd need more intake and information. And when I really started to look carefully, they Jordan met very close to full criteria, not quite. So I would say that, and also maybe do meet full criteria, but we need some more information overall. Did you have that same take?
Exactly. And I would want to explore more, especially with in terms of the impulsivity of the behaviors that, that he
Mm-hmm.
denies a history of psychosis or like alcohol use too much or anything like that. Even more, though, I'd want to really get a profile on if there is some substance abuse because, um, the dissociative type, some of it behavior of feeling flat and, and things like that. Don't know who I am unless I'm with somebody else, those kind of things.
Mm-hmm.
It would even more want me to dive into, is there some sort of substance being used in order to rule out any other things kind of going on. But that was my initial gut reaction of it meets more than the five criteria for um borderline
Borderline.
personality. Yeah. Yeah.
Yeah. And we can drill down into because it does ask what specific criteria. We can drill down next, but I would say in terms of which personality disorders were still on the short list
Yeah.
versus those that did not seem likely, I would say that it was interesting, really. It was the relational ones, the ones that really had to do with sort of codependent relational framing of the self in relation to others.
Yeah.
So the on the list I thought were histrionic
Hmm.
and avoidant and dependent, where Jordan came very close to meeting all of those criteria as well. But would you like to,
I felt
well,
that
first of all,
not.
how about you? And then also maybe we talk about how the borderline personality disorders criteria were met.
Yeah, for me, it was pretty much going out. Okay, he didn't seem to have, any of the really big for paranoid because we didn't see the pervasive, the suspiciousness of others.
Suspiciousness.
It didn't seem like there was
Yeah.
any of that going on. That more than
Hmm.
anything, it felt like impulsivity in behaviors. So it
Hmm.
made me even go, is there
Hmm.
some other thing going on? Could there be an ADHD component? Could there be, some other, again, would want to do a workup on what the trauma background is. and
Mm-hmm.
that sort of thing. But when it goes to looking at, the schizoid personality disorder and the schizotypal personality disorder, neither one of those seemed, because just talking in this initial, it didn't seem like there was a lot of emotional fluctuation. It seemed like pretty
Right. There didn't
consistent.
seem yeah,
Yeah,
there didn't seem to be the detachment for the
exactly.
schizoid. In fact, just kind of the opposite in terms of
Exactly.
neediness. And then the odd beliefs and magical thinking of the schizotypal also didn't
Yeah,
seem to
it
fit.
didn't seem I mean, at the end where we has a list of him asking, are you gonna get tired of me like other people? Again, that seemed more of the validation kind of feature of afraid of abandonment and that sort of thing, what you see with borderline personality disorder. Um, just
Hmm.
even in that little bit right there. Do you want to go down the list of why we think it is borderline?
Sure. I don't have that page in the DSM called up right now. I can open to that if you don't
I
have it open.
Yeah, I took notes. I took notes with the number one being the pervasive pattern of interpersonal relationships, the marked issues of impulsivity. That is in here with the marked impulsivity being one, the frantic efforts to avoid abandonment, which it talks about there that it sounds like kind of sets up relationships where he's really invested in the person and it's really hot at first. And then he says, he starts to not have those feelings pretty quick.
Mm-hmm.
That could be because he's afraid of abandonment that he starts to pull back that energy. So that
Mm-hmm.
being number one. Number two, again, the pattern of unstable, intense interpersonal relationships, that one as well. Number three is identity disturbances. That was one of the ones that I was questioning about. There didn't really
Right. Although
seem,
I did feel like it. Sorry, go ahead.
oh no, go right ahead.
Oh, I just thought I had, that's funny. I had the same hesitance, but then I thought, well, there's the statement about, although it is relegated to relationally being attached to someone, that I don't know who I am.
Without, yeah,
Hmm.
unless I'm with someone.
Right. So that felt met too.
That's exactly that was my thinking of like, well, there's not maybe sustained within this part of what we're given, but maybe the more over the course of more time you would speak to the client, more of that would come out
Hmm.
that, there is that
Exactly.
instability with his identity, not knowing who he is without a partner. The impulsivity one we already got as well. Um,
Yep.
and we don't know if it's necessarily substance related, but there is the discussion of sexually kind of, risky behavior,
Risky behavior. Hmm.
which can definitely qualify for that. The other one, the recurrent suicidal behaviors or gestures or threats or self-mutilation, self-harm behavior. There was the mention of
No
deny suicide.
self-harm.
Yeah, deny suicidal
Yeah.
intent, but reports occasional passive thoughts. Um,
Right.
which can be that's still some passive suicidal ideation is still considered within that realm of, somewhere in there. And again, the more you talk to the client, the more it might come out that those are more pervasive feelings.
Hmm.
Um, and that could lead to the depression, part. That was number five. Number six, affective instability due to a marked reactivity of mood. Um, so intense episodic dysphoria, irritability, or anxiety. He talked about not having, he denies sustained depressive episodes, but
Hmm.
it's hard for me to read it on here. But he does have kind of, it seems like moments of kind of disassociation or dysphoria, or even the depersonalization, where he talks about going in and out when he's stressed.
Yeah, and also like again, it's relational, but I don't understand why I go from feeling so close to someone to feeling like I can't trust them at all.
Exactly.
Um, and a reactivity, like you said, brief periods of low mood and loss of motivation, typically lasting a few days.
Hmm.
Um,
It's
lasting a
hard
few
for me,
hours
sorry,
with
it's hard
only
for me to
literally
read
more than.
the list behind, but I can go number 7 is chronic feelings of emptiness, which I think that he kind of fulfills that as well, talking about that um the low moods and or is it the flat
Feeling flat.
feeling? Yeah,
Jordan
flat.
reports feeling empty, flat, and unsure of who they are. Yeah.
Yeah, that could
Um,
definitely qualify for that.
so
Um,
so there we've met five. One, two,
yeah,
three, four. We're not sure about five, but it has met number six, which means those are five of the
yeah,
following have been met.
yeah. And then even if we kept
Um,
going with number 8 being the inappropriate, intense anger, um, he talks about that he gets angry.
mhm.
Um, People describe him as being distant and critical. Um, some of these things, it's like rapidly but changes between sadness, anger, and anxiety. So the shifts in affect in that way, again, that meets another criteria. And number 9 being the transient stress related to paranoid ideation or severe dissociative symptoms. He doesn't seem, again, in this little snippet that there's a lot of disassociation, but I mean, he does lean into the paranoid of people leaving him, where he's leaning into, are you going to get tired of me like other people do? If it's somebody asking their
Mhm.
therapist that,
Right.
that's got to be a good
Agreed.
indicator, right, of what they're going to be like
Yeah.
with other people. You're just a therapist. This isn't a close relationship. If he's asking me that and we
Right.
just met, you wonder what it's like.
Yeah. Yeah.
So
So, great. So thanks for those specific criteria. They definitely support the case because there's five or
definitely.
more of those following to meet borderline. And then are there multiple possible diagnoses within the personality disorder? We talked about them more generally, but I did a little drill down too.
Yeah,
I guess I could briefly mention the histrionic,
yeah,
um, center of attention. That's kind of hard to maybe gauge a little bit in the therapeutic office environment, but and then the sexually seductive, provocative. Are we seeing this or not? That would really require more more intake around these sexual escapades or risky behavior that they're talking about.
yeah,
How often does that happen, and a little bit more of the situational framing of the motivation for it and the way that unfolds. But I
yeah,
did think rapid emotional shifts, which
yes,
is one, was met, and then um, let's see, physical appearance. That was kind of, they said they spent an appropriate amount of time. Sorry, inappropriate amount of time on clothes and grooming to impress.
yeah,
So again, really points to the idea that we need further. This is instructive, I think, and purposefully so. Like you
yeah.
can't just give a diagnosis. You need more sessions because you'd really want to follow up on, okay, well, let's talk about this impulsivity and spending. What are you shopping for, right?
And so that part is the only other thing for me in terms of also looking at the antisocial personality disorder. That was my other, I mean, looking at could there also be a component of that being with the impulsivity, of the behavior with the shopping or with the other in the sexual risky behavior, and the irritability and aggressiveness are things that are, reckless disregard for safety are also things you see within the antisocial. So it made me kind of
Right,
go, is there somewhere in there that there's kind of a meshing, you know what I mean, of
right.
that as well?
I wrote the same question down here for histrionic. I said the sexual component needs further consideration. and examination, is it impulsivity and abandon, which would be more the borderline personality disorder, or is it
Yeah.
need to impress, which would
Yeah.
then be more the histrionic? So,
Yeah.
um,
Yeah.
and then let's see, style of speech, excessively impressionistic. I'd say that doesn't seem to be coming out in the intake, but shows self-dramatization, theatricality, exaggerated expression of emotion. Also, not quite sure if that would need to know more about how they're presenting during
Yeah.
session. And then is suggestible, easily influenced by others or circumstances. That seemed like it might be met again with their obsession of being in a relationship and getting conditional appreciation from
Yeah.
that other person, that they would actually end a relationship because of what the person is saying about them, kind of
Yeah.
suggests they are that impressionable and
But
suggestible.
also, and that's where I was also curious because ending the relationship because of not just receiving the reassurance that they need, but possibly because of what the person is saying about them, maybe that's all paranoia. That could be the component
Mm-hmm.
within that as well, that he's also meeting for that
Mm-hmm.
criteria of it could be his perception of that people are saying things about him.
Yeah.
Um, or that he's
Yeah. So
afraid,
more just,
you know. Yeah, go ahead.
yeah. More discussion about the nature of past relationships and this past breakup to figure out some of the criteria questions for more than one of the other disorders that could be
Yeah,
a potential, as opposed to, or in addition to, as the text says, you can have two at the same time. They
that's
can be
where,
overlapping. So
yeah, that's where I
yeah,
went with
the
the
last
borderline
one.
and possible antisocial. Yeah,
Yeah, or histrionic, because the last one
yeah,
is for that histrionic is considers relationships to be more intimate than they actually are. So that might fit the background information
yeah,
from Jordan. It would need to ask a little bit more about how these
yeah.
relationships are sitting with them in
That would
terms
be
of
that.
their self-definition.
That would definitely be that area where it says you see overlap and the ambiguity.
Yeah.
I would also say that, I looked at narcissistic going, okay, does he seem like he has a grandiose sense of self, importance, any of that? And he didn't, none of that really seemed
Yeah.
to factor in,
I
you
ruled
know.
that one out too, I think. I
Yeah,
mean, not like absolutely clean, but that did not seem like a likely overlap or yeah.
yeah, yeah.
Um,
And then going to, do you want to go to,
avoidant,
yeah,
do you? Yeah, I thought, well, what I wrote down about avoidant was, is Jordan heading this way? And I think that was kind of like when they talk about looking at that these personality disorders are kind of tricky in diagnosing and in in talking about as a therapist, because you want to get like sort of a holistic look at their trajectory, and also
yeah,
the understanding, which is nice, that they can change. And so for me it sort of felt like one of the differentials was um let's see, uh okay, social inhibition, feelings of inadequacy, hypersensitivity to negative evaluation. Definitely had hypersensitivity to negative evaluation.
yeah,
So when the first one is avoids interpersonal contact because of fear of rejection, is that what's going to happen? Because doesn't, I think it says something like, you're right, it's kind of hard to scroll through and also look at
yeah.
but I
Um,
think he or she, they are um okay, ongoing difficulties in relationships, particularly romantic ones, pattern of becoming intensely involved early on, feeling a strong sense of connection, and then shifting quickly um, within a few weeks or months, beginning to
sorry.
feel uncertain and anxious that the partner's losing interest. So, um, feels overwhelmed. If reassurance is not received, can become angry and withdraw. Often feels regret. Attempts to reinitiate contact.
And it has
So
in
at
there the
this,
second. Oh, go ahead. Sorry.
oh, so then in additional to relational concerns, then they go on to moods, issues, and depressive episodes, um, and no reported history of self harm. Da 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 da. But their childhood definitely has some attachment issues going on there, in the wider scheme. So they adjust their behavior to meet others' expectations, engaged and articulate. So I guess avoidant, maybe not, except it seems like if this doesn't get some treatment, that this could turn into or is close to avoidant. Because if this becomes
Mhm.
continually distressing and impairing,
Yeah.
then Jordan may begin to avoid relationships as a result. Um, so do they meet, avoid interpersonal contact, unwilling to get involved with people unless certain of being liked, preoccupied by being criticized or rejected socially? Um, I think it's might be going there, if that makes, does that
Yeah.
make sense? I'm
Yeah,
not being
no.
very articulate, but
No, that's okay.
these criteria could be met
Yeah,
soon.
no, like definitely. And I mean, the looking at and to go back to the personality organization part of number two question, using the psychodynamic framework, how would you understand Jordan's level of personality organization? I think that also relates to the attachment there of it doesn't seem like he's neurotic. It doesn't seem psychotic at all. It's more the borderline where he's also on bordering on being able to lose the ability almost to have relationships in that way, in that constructive, meaningful
Right,
way that he's becoming. If
right,
he's not already avoidant, he's on that trajectory of borderlining on becoming more of an avoidant person because he's afraid of the abandonment. So he's afraid to get attached. He's afraid, of all these things. He's throwing up roadblocks ahead of time. Um, and I think
right.
that then the next, with what evidence supports your assessment, it would be, within what he even said about needing to have relationships, it being hot, at first, and then him being the one to kind of cut things off. Or also being the part about uh, Jordan, he needs reassuring. Seeking reassurance through texting or calling becomes distressed when responses are delayed. So there is a little bit in terms of like attachment that maybe there is a little bit of, anxious attachment, but it seems like that even goes more towards avoidant because if it doesn't become exactly when he needs it, then he doesn't want, then he's being abandoned or rejected, which again supports the borderline personality disorder diagnosis.
Yeah.
Um,
Um, and then so the reality testing is intact. I think you may or may not have said that, which is keeping the in the borderline kind of realm.
yeah.
Um, and then this goes on to the next question of the splitting and projection is really prominent and articulated around partners. The
Mhm.
idealization and devaluation of like they're fantastic
Yeah.
and then suddenly they're terrible.
Yeah. And
Right.
it could be
Yeah.
just be because they're not, it sounds like it could just be because they're not returning the text as quickly as expected or returning the phone call as quickly as he needs. Then it becomes, no, they don't want me or this isn't working. There's that quick escalation of his needs aren't getting met. So I'm done with it. That seems to
Yeah.
be kind of what it sounds like. Again, which
That I don't,
supports that.
you're doing a good job of moving us forward so we don't so we don't go too long. So I don't want to like inhibit that, but I did just want to say it also,
Yeah, go
the
for it.
last one, the dependent personality disorder, also felt like
Mhm.
Jordan came close. Um, when
Definitely.
they say a pervasive excessive need to be taken care of, clingy behavior, fear of separation. So
Hmm.
again, we'd need more info here on their own self-concept and more
Hmm.
their agency, right? Like I felt like
Definitely.
probably not, but that would depend on how much agency and behavior is lost or shifted when not in relationship, right? That could kind of
Yes.
determine the dependent quality.
And
Yeah,
and
because
how
goes to excessive lengths to obtain nurturing from others, feels uncomfortable when alone, urgently seeks another relationship when one ends, unrealistically preoccupied with fears of being left, met all those criteria for dependent, seems like,
yeah. And I
but
would say
maybe not.
probably, oh, go ahead.
Oh, just maybe not so vulnerable, and maybe not when they say submissive and clingy, that was the part where it didn't seem like all the criteria for that particular one was met, but might
Mhm.
require a little bit more session work to
A little bit more
see.
digging too, but possibly I think
Hmm.
talking even, looking at past history in terms of other
Yeah, and
therapists'
the
notes.
attachment thing. Yeah,
Yeah,
exactly.
and other
Hmm.
therapist notes, and if possible
Hmm.
family history, that sort of thing. Again, trauma
So
background.
relational patterns, we're kind of right
Exactly.
there, number three.
Yeah. Yeah. I like the question about how might two different clinicians diagnose Jordan differently?
Oh, do we
That,
feel like we've covered three?
yeah, yeah, I think so. And I mean, we pretty much agree. So it's like
Okay.
if we ourselves are doing this as two different clinicians, right? Um,
Yeah.
what would be that we're fairly on the same sync as what we think is going on with, that we even see that there's overlapping. We even see that there's some things that you see the more the histrionic and I see more the antisocial. So, but
Yeah,
because it can
I just
be
wanted to touch
overlapping. No, go ahead.
I just wanted to touch on number three really quickly,
Oh
relational
yeah.
patterns, because it asks about how they might emerge in the therapeutic relationship. And
Oh,
it seems like Jordan may put unrealistic standards on the therapist's esteem and assessment of them.
mhm.
And by um, ability or alacrity in analysis and treatment success. So that idealization, then followed by rejection or abandonment, we might want to address that early on in the therapeutic relationship as gently as possible. Like,
Yeah.
seems like, there's some issues going on. You've mentioned the stuff about your mom and dad. That's very interesting that you were sort of split between trying to please or interrelate with two pretty different parents, and then we're
hmm
seeing in your own relationships, and you're wisely seeing in yourself a pattern where you're very close and idealizing your partner and then later on not. So I just, there might be a way that you could actually discuss transference with them and say, let's be sure that we've got these open lines of communication and see how that might play out here, because I'm really here to help you. And, because
Exactly.
there could be that risk that suddenly they don't come to therapy anymore because they've done that whole defensive splitting with you too.
Exactly. Or the setting up that you're going to be abandoning them because you only have X amount of sessions, or,
Right.
that already, oh, you didn't respond the way they expected to in session. You must not like them because, again, they can read into that, assigning that kind of paranoid projecting these things onto you, or, you're talking about them when they're not there. Again, that paranoia that can be created. Um,
Right. And I was kind of thinking how when the personality disorders or potential personality disorders in cluster B
yeah,
might be a little harder to bring up the question of personality disorder to begin with, because the stigma and the dependent emotional regulation, they're so hypersensitive to what other people think of them and feeling rejected. So Jordan expecting like unconditional and constantly reinforced affirmation and
yeah.
validation that 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 ultimately they need to get from themselves. That's sort of at the crux of that in terms of the therapeutic relationship, right? And
Well,
feeling how to navigate that.
I would think that, I mean, that goes to, again, in relational patterns, the question number three of three, what might Jordan be implicitly expecting from others without ever saying it? He's expecting from others that constant reassurance that he doesn't have, like he
Mm,
doesn't have that within himself. I think as a clinician, that's something that you would be working on in session too, of teaching him the
right.
teaching the self validation, teaching, when you start to feel this way in relationships, as articulating, communicating to the other person, other than just
Yeah,
cutting things off.
yeah, a great opportunity for psychoeducation there.
Right. Yeah, that was my but big thing that I
Yeah.
saw from that is that, reading, doing the other reading about, is it possible for someone to heal or, correct
Change.
from a person change from
Hmm.
a personality disorder. I like that they leaned into, yeah, it is possible. but these certain things
Mm-hmm.
have to be done. And this seemed to be a perfect example of somebody that through psychoeducational could learn how to meet their own needs. Maybe still have some
Yeah.
of these, just maybe still have some of these features, but at least maybe become more stable in their attachment even to others, and to themselves. I
Yeah.
think that's something that can be taught. And it sounds like this is somebody that might be able to learn that. Um,
Yeah.
and
Number
occasionally you do,
four, the differential diagnoses.
yeah.
I think they're definitely alternative overlapping explanations that need to be considered.
Hmm.
Trauma-related patterns, absolutely.
Hmm.
Um, could have PTSD from childhood and all the
Exactly.
attachment stuff. We've already talked a little bit about, but
Mhm.
that's instructive from a psychodynamic perspective. Might be an anxious, ambivalent type, and deconstructing that and analyzing the adult relationships through the lens of attachment could be, we were
Definitely.
just saying, really important psychoeducationally. Mood
Yeah.
disorder. I don't know about you. Did you? I thought that some manic. It seemed a little bit like there might be uh, like I'm wondering if we're in this. Have we just had one session or have we had more sessions? Because my question was,
From the way I
we
read
should
it was
screen
this
for
isn't an,
mania.
yeah, the way I read it, this is our first session. That was my interpretation of it. Um, but I would say that this would be someone that we would be screening and putting on to measure if they meet the, um, the, sorry, I'm blanking, but be meeting the
No,
criteria
that's okay.
for
It sounds
having,
like you agreed that I said yes for mood disorders. Many of
yeah,
their statements fit kind of into a bipolar possible
yeah,
presentation. And so evaluation should be done around manic episodes in the
yeah,
past and sleep patterns and figure out like where we
exactly.
might be receiving this information.
Where we might be on that cycle. If this is the middle of it, right before he's going into a manic episode, that might be even more going on because it can be the overlap between personality disorders and the mood disorders. Um, let's see, what helps you distinguish between these possibilities? Again, I think the being able to distinguish that is going to be over time that we're going to have to kind of map out the trajectory of where he's going with this. Um,
Yeah, I think there's a separation anxiety disorder that you should screen for. I think there are some screening tools to be
mhm.
employed. And also, like, in terms of the mood disorders, like, uh, yeah, trying to gauge if, if, um, if some of these answers around they were fantastic, no, they're terrible, could be
Mhm.
aligned with, like asking some important questions around timelines. Like, when did you start to get really depressed? And then when did
Yeah,
it could be a chicken and the egg. Like maybe she was
yeah,
wonderful because you were manic, and then she was terrible because you were in the depression cycle. So try to sort of
exactly.
ask more questions and follow up um, with that screen in mind.
Yeah, definitely. I think the other part that we would also be going to, and we are at 4 minutes, just so you know. I
Oh,
think
wow. Okay.
yeah, that's why I was trying to um go quick. I think the other part about it, if we move on with through number five, um,
Hmm.
what aspects of the case leave room for, sorry, I'm having trouble reading it with the black box.
Okay. I think we kind of answered all of five.
Yeah,
Basically, you were bringing it up. What role might the clinician play in countertransference? Just like the interpretation of, for example, the shopping, just as an example. Like,
yeah,
are we thinking that Jordan is being provocative or in the way that they're talking about that, or is that really something that's just more about impulsivity and being sure that
yeah,
you're making sure to entertain all of these different possibilities of presentation and not just taking your own assumption too quickly.
definitely.
And as you said, like there's more to be determined. You could be thinking more, I could be thinking more that, in fact, it even sort of seemed like, well, I'm thinking they're more avoidant and you're thinking, or I'm thinking they're more dependent and you're thinking they're more avoidant or vice versa.
Mhm.
So,
Exactly.
yeah.
And I would be
And then the
curious,
last one,
uh,
no, go ahead.
I would just be curious also to find out more of, is he saying these things for shock effect? Is there that certain,
Mm,
kind of thing there where it is the attention seeking? How much truthfulness are you getting? Which you can see with, the borderline personality disorder of, trying to lead you one way or the other, trying to get you to think
mm,
they are a certain way or another, with the,
hmm.
you know, trying to elicit something from you for you to believe, one way. So I would think even more getting over time to see where's the truth in this. Is he trying to get you to believe one thing when this is really what's going on? Because of the
Yeah.
self-deception. There's kind of like a self-deception, it sounds like. So it would
I
be over
think that
time.
leads right into the last question real quickly, which is,
Yeah,
um, I don't know if you agree, but I think kind of that question of, hey, are you liking how I'm coming off, or are you going to leave me like other people? In a way, there's sort of a pathos in that and kind of a really brave honesty in Jordan
yeah,
asking that question. And I
yeah,
think if that question is fielded really well by us as a therapist, it could be a great opportunity for, as we said,
definitely.
psychoeducation, but also saying, hey, brave of you to want to be so direct with me and ask that question and
Exactly.
examine the interrelational aspects of how you relate to people. Let's go there. Let's discover that
Yeah.
together. Let's
Well,
talk more about it.
and there might be someone who would benefit, and we're almost at time, or in a minute, but it might be also someone that would benefit for almost like charting of this is how many sessions we have, this is how long we're going to be together. So you're counting down sessions of how many more you have. So it's not this abrupt ending, right? If that's what they're so
Yeah,
afraid of, or that's what everything focuses on,
exactly.
this fear of abandonment, we we delay that at least by saying this is how long we're going to be together to give that sense of reassurance.
Yeah, good
And
point. Yeah.
we're at 1 minute. So
Okay.
awesome. Yay. And I will upload and send it, and I will go ahead and end our recording.
Okay.